Welcome back. Today, we're diving into the top 10 everyday medicine and health essentials from 1900 to 2000 that have shaped healthcare at home and beyond. From simple thermometers to essential eyeglasses, these items have evolved over the decades to become indispensable in managing and improving health. Join us as we explore how these tools transformed medicine and contributed to modern wellness. If you enjoy this journey through healthcare history, be sure to like, subscribe, and let's get started. 1. Thermometer, 1800s. Evolved through 1900s. Thermometers have been a cornerstone in home healthcare for over a century, allowing people to measure body temperature and detect fevers. Early thermometers were often bulky and fragile, requiring careful handling and precise reading skills. Mercury thermometers, introduced widely in the 20th century, became household staples, giving a reliable, straightforward way to monitor health. In the late 1900s, electronic thermometers were introduced, bringing faster and safer temperature measurements to the forefront. This transition has continued into the 21st century, with infrared thermometers now allowing contactless readings. 2. Eyeglasses, circa 1900-2000. Eyeglasses have provided essential vision correction for millions, enhancing quality of life and accessibility. In the early 1900s, glasses were mostly utilitarian and often expensive, making them less accessible to the average person. Over time, materials like plastic and lightweight metals were introduced, making eyeglasses more affordable and comfortable. Styles evolved, with frames reflecting trends and personality, turning eyeglasses into both a medical necessity and fashion accessory. Eyeglasses continue to be crucial for those with vision impairments, now with advanced options such as bifocals, progressives, and even blue light filtering lenses. This simple tool is a prime example of healthcare blending with everyday life. 3. Bandages, early 1900s. Bandages have been a lifesaver in wound care, helping to prevent infection and speed healing for cuts, scrapes, and injuries. Early bandages were simple cloth strips that required careful wrapping and sometimes even needed tying. The adhesive bandage, invented in 1920, was revolutionary, allowing people to easily cover wounds without help. As the years passed, bandages became more effective and specialized, with waterproof and fabric varieties offering even more convenience. Today, bandages come in countless shapes and sizes, catering to everything from minor cuts to larger wounds, and remain a first aid staple worldwide. 4. Aspirin, 1899. Popularized in 1900s. Aspirin, first developed in the late 1800s, became one of the most widely used pain relievers and anti-inflammatories throughout the 20th century. Initially used for pain and fever reduction, aspirin soon found a place in every home as an effective over-the-counter remedy. By the 1970s, it was also discovered to have heart protective properties, reducing the risk of heart attacks and strokes in low doses. Despite the rise of alternative pain relievers, aspirin remains popular for its multifunctional benefits. It's an enduring medicine cabinet essential, still valued for its effectiveness and versatility in treating everyday ailments. 5. Syringes, 1900s. Syringes have been critical in administering medicine, especially for injections and vaccinations. Early syringes were made of glass, requiring sterilization between uses, but were essential in delivering medications directly into the bloodstream. In the 1950s, disposable plastic syringes were developed, allowing for safer, single-use applications that reduce the risk of infection. Today, syringes are not only vital for healthcare professionals, but are also used at home for conditions like diabetes, where insulin injections are required. Their development has made treatments more accessible, with syringes being a trusted tool in both hospitals and home healthcare. 6. Antiseptic cream, early 1900s. Antiseptic cream became a household essential for treating minor cuts, burns, and abrasions, protecting wounds from infection. Before its invention, wounds were cleaned with salt water or alcohol, which could be painful and less effective. The development of antiseptic creams offered a gentler and more efficient way to protect injuries, making home wound care easier and safer. With the evolution of formulas, these creams began to include soothing agents and pain relievers, further enhancing their usefulness. antiseptic cream remains a vital first aid item, underscoring the importance of effective and accessible wound care. 7. Stethoscope, widely available by 1900. Although typically associated with doctors, the stethoscope became an important tool for personal health monitoring, especially in families with heart or respiratory issues. Early stethoscopes were basic, single-head devices that provided only limited acoustic clarity. Over time, advancements in materials and design improved their accuracy, enabling clearer and more precise listening. Today, digital stethoscopes even allow sound amplification and recording. While primarily used by healthcare providers, stethoscopes are also used at home by some patients or caregivers for monitoring health, demonstrating the evolution of tools initially designed for professionals that later entered home healthcare. 8. Blood pressure monitor, 1900s. Blood pressure monitors became a home health staple, allowing individuals to manage conditions like hypertension without constant doctor visits. Early monitors were cumbersome and often inaccurate, requiring manual inflation and professional assistance. In the 1970s, automatic blood pressure monitors made their way into homes, allowing more accurate and user-friendly readings. This development empowered people to take control of their cardiovascular health by tracking daily blood pressure levels. Modern digital monitors even store historical data, helping people track trends over time. Blood pressure monitors have become indispensable for millions, highlighting how healthcare technology can transform personal health management. 9. Hot water bottle, late 1800s. Widely used in 1900s, the hot water bottle has been a simple yet effective home remedy for relieving aches, cramps, and cold hands and feet. Originally made of metal, these bottles were later crafted from rubber, which made them softer and safer for direct skin contact. Hot water bottles provide soothing warmth, making them a favorite choice for easing muscle pain and discomfort. Over the years, they became available in various sizes and shapes, with plush covers for added comfort. Today, electric heating pads are an alternative, but the classic hot water bottle remains a comforting and economical option in many households. 10. Cough syrup, early 1900s. Cough syrup became an essential home remedy for managing colds, sore throats, and minor respiratory ailments. Early formulas were simple but effective, often containing honey and herbal extracts to soothe irritation. In the 20th century, pharmaceutical companies began developing more targeted formulas that addressed specific symptoms like congestion and throat discomfort. Cough syrups evolved to include daytime and nighttime options, allowing for symptom relief without causing drowsiness or disrupting sleep. Today, cough syrups remain a go-to treatment for seasonal illnesses, with a range of options tailored to individual needs, from children's formulas to extra-strength solutions. Thanks for joining us on this exploration of healthcare essentials through the decades. From thermometers to cough syrup, these everyday items have made a lasting impact on home health and wellness. If you found this dive into healthcare history fascinating, don't forget to like, subscribe, and stay tuned for more deep dives into the innovations that have shaped our lives. See you next time.